Bedwetting in Children, a comprehensive guide for parents. Introduction: Understanding bedwetting and its emotional impact. Bedwetting, also known as nocturnal enuresis, is a common occurrence in children that often causes frustration for parents and emotional distress for the child. Many children experience episodes of bedwetting during their developmental years, and while most overcome it, naturally some require additional support and guidance. It is important to understand that bedwetting is not the child's fault. It is a biological process influenced by nervous system development, bladder control, and emotional factors. Punishment or frustration only leads to shame and anxiety, delaying progress instead of resolving the issue. Parents play a key role in creating a supportive and non-judgmental environment that fosters a smooth transition toward dry nights. At Seeds of Tomorrow, we emphasize positive parenting strategies to help children develop self-confidence and overcome challenges without fear. Through practical techniques, emotional guidance, and medical awareness, this transition can become a stress-free and encouraging experience. Section 1: Common Causes of Bedwetting in Children. Bedwetting is influenced by multiple factors, including biological, emotional, and genetic components. Understanding the root causes allows parents to take the right approach for their child's situation. Developmental delays in bladder control. Some children's nervous systems take longer to mature, resulting in difficulty recognizing bladder signals during sleep. This is a normal biological process and does not indicate laziness or disobedience. Deep sleep patterns. Children who experience deep sleep cycles may struggle to wake up in response to bladder fullness. Their bodies simply do not register the sensation until morning. Genetic predisposition studies show that children with a family history of bedwetting are more likely to experience it themselves, indicating a strong genetic component. Psychological and emotional factors, stress, anxiety, and major life changes, such as starting school, parental separation, or moving to a new home, can trigger temporary bedwetting episodes. Fluid intake and bladder sensitivity. Drinking large amounts of fluid before bedtime or consuming bladder irritants, such as caffeine or acidic drinks, increases the likelihood of nighttime accidents. Parents should view bedwetting as a temporary phase and focus on understanding rather than frustration. Section 2: When to seek medical evaluation. Bedwetting usually resolves on its own, but in some cases, medical evaluation is recommended. If a child over the age of 7 still experiences frequent episodes or suddenly begins bedwetting after a long dry period, it may indicate an underlying issue, such as urinary tract infections. Symptoms include painful urination, strong-smelling urine, or daytime urgency, diabetes, increased thirst. Frequent urination and unexplained weight loss may accompany bedwetting. Hormonal imbalances. The body's ability to produce antidiuretic hormone, ADH, which reduces urine production at night, may be underdeveloped in some children. Sleep disorders. Conditions such as sleep apnea may interfere with proper nighttime bladder control. Consulting a pediatrician helps rule out medical concerns, ensuring that parents take the right approach for their child's unique situation. Section 3: Practical strategies to manage and reduce bedwetting. Gradual bladder training. Encouraging children to use the bathroom before bedtime reduces the chance of nighttime accidents. Limiting excessive fluid intake in the evening, while ensuring proper hydration during the day, supports bladder regulation. Bedwetting alarms. For older children, bedwetting alarms help train the nervous system by waking them when moisture is detected. Over time, they learn to respond to bladder signals effectively, creating structured bedtime routines. Consistent evening habits, such as calming activities and mindfulness techniques, help children relax, reducing anxiety-based bedwetting. encouraging positive reinforcement. Praising dry nights rather than focusing on accidents builds self-confidence and reduces stress associated with bedwetting. Using absorbent nighttime protection. Specialized underwear and mattress protectors reduce discomfort and anxiety, making the process less stressful for the child. Section 4. The emotional role of parents in supporting their child. Bedwetting often impacts a child's self-esteem, leading to feelings of embarrassment or frustration. The way parents respond has a major influence on how a child copes with the experience. Avoid punishment or shame. Children do not wet the bed intentionally. Responding with patience and encouragement fosters emotional security. Normalize the experience, reminding children that bedwetting is temporary and common among kids. Their age reduces anxiety and boosts confidence. Encourage open communication. Allowing children to express their feelings about bedwetting helps reduce stress and frustration. Reassure them of progress. Celebrating even small improvements encourages children to continue making positive changes. At Seeds of Tomorrow, we advocate for a nurturing and supportive approach, ensuring that children feel secure and empowered throughout this process. Section 5. Real-life success stories from parents. Case study gradual improvement through structured routines. A mother implemented consistent nighttime bathroom trips, reduced fluid intake, and incorporated a reward system. Over time, her child experienced fewer accidents, leading to completely dry nights within months. Case study overcoming emotional bedwetting. A child experiencing stress-related bedwetting due to school anxiety benefited from mindfulness exercises, deep breathing routines, and gentle encouragement. Within weeks, their confidence grew, and bedwetting episodes significantly reduced. These real-life examples show that with patience, practical strategies, and emotional support, children successfully transition to dry nights. Conclusion: turning bedwetting into a stress-free learning experience. Bedwetting is a temporary phase in childhood development that requires understanding, patience, and positive reinforcement. Rather than focusing on the frustration of accidents, parents can guide their children through this process with gentle strategies and encouragement. Through gradual bladder training, emotional reassurance, structured bedtime routines, and medical awareness, children gain confidence while overcoming this challenge with ease. At Seeds of Tomorrow, we are dedicated to supporting parents with psychology-backed insights and nurturing techniques to ensure a stress-free and positive parenting experience.